everyone. Would like to welcome you to this side event on decriminalization of drug use and drug possession. Happy that so many people at that early morning. Oh, harder? Okay. Yes. Okay. Good morning. Very happy to see you all here. My name is Katrin Schiffer. I'm Director of Correlation European Harm Reduction Network and also acting chair of the Civil Society Forum on Drug in Europe. At this side event, we will present scientific and political context of decriminalization, explore different models, look into different experiences and practices, and also potential challenges for how to implement it. First, I would like to thank the organizers, Drug Policy Network Southern Europe, but also the supporters, namely the Permanent Mission of Serbia and Montenegro, for supporting this event. Also, all the others who support the event. We have a distinguished list of speakers, and I think comparable to all the other side events, we try to have a question and answer session at the end of the session when all the speakers have done their talk. So I would like to ask you to keep your questions and potential comments until the end. And without much ado, I would like to introduce the first speaker of this event. This is Sophie. Sorry, yeah, this session is recorded, so you should be aware of that. First speaker is Susanna Rocconi. She is representing Forum Droge Italy and is also part of the Civil Society Forum on Drugs. And she contributed significantly to the development of the CSFD statement on decriminalization, which was published this week. Last week. And she did mainly, she explored the political and scientific evidence around this.
Thank you, Katrin. I have some slides. Okay. Yeah, I want to share with you some background reasons why the Civil Society Forum on Drugs decided to adopt a position paper on decriminalization of personal use and possession for personal use, supporting decriminalization perspective. I want to say that it has not been an easy process because, as perhaps you know, the Civil Society for Drugs is an expert group of the European Commission, and it includes every kind of positions inside civil society. And decriminalization is a very sensible issue. So we had a very long process to try to find a good mediation and negotiation and between our positions. But at the end we were successful, I think. I want to start with some consideration about the two contextual factors that suggested the forum to make this work and write down this position paper. The first is obvious, I want to say, and that is that the decriminalization of drug use and possession for personal use is on the agenda, is on the political agenda all over the world, and in Europe too, of course. Many states are looking for a more effective and human approach to the drug phenomenon, starting from difficulties and not successful outcomes of the current the drug policies in general. And so there is an ongoing reform process in many, also in Europe, in many member states, in a decriminalization perspective. And civil society and the communities have been fighting for decriminalization for many years and decades, I would say. And so we thought that there is a matter of political responsibility of a forum which is a civil society forum. So we had to take a position on that, and this is the beginning of the process. Another contextual factor is the fact that the issues of human rights in drug policies has become a very relevant issues in the last year. As we can see also here in Vienna, we have always discussing over how drug policy must be based on human rights respect and promotion. We know that since the General Assembly in 2016, many UN agencies advocate for drug policy based on human rights, and many UN agencies stress the strong and evident link between criminalization and human rights violation in many different fields. Furthermore, this UN agency wrote down also very clear recommendation in favor of the decriminalization process as a structural precondition to counter violation. This is very important because when we talk on human rights, if we are not able to consider the structural reason why human rights are violated, we risk to have a rhetorical discourse. So this is very important. And I remind that the very important document on that last year by the Office of the High Commissioner on Human Rights that we discussed so many times here in Vienna. And then quickly 3 reasons that we discussed inside the forum in favor of the decriminalization perspective. The first is the ineffectiveness and, on the contrary, the negative impact of criminalization. We see that there is no effective compensation in terms of criminalization, in terms of limiting and controlling both the demand and the drug supply. So criminalization doesn't work, and we have a lot of evidence of this, just starting from the data that the UNCND itself every year produces. And on the contrary, we have a great evidence of many so-called unintended negative effects of people who use drugs, communities, and society. We discussed also another point that is the failure of the deterrent, of the so-called deterrence effect. This is not only true in drug policies, but is also an important debate in criminology in general. The deterrence effect of prisons and punishment is not effective and doesn't work. And then there is a big imbalance between cost and benefits of the criminalization policies. A second reason is stigmatization. This was a very important part of our discussion. Every official statement from the use strategy to many UN papers said that it's very crucial to fight against stigma, because stigma is a source of discrimination and human rights violation. So we discuss about the so-called circle of the stigma. We know that stigma is a very complex process, but we know also that criminalization is a very strong structural and impactful factor of a stigma. The next slide. The last reason we discussed deals with limits of model based on alternative and administrative sanction. It is true that alternative sanction and administrative sanction limit the incarceration and of people who use drugs. But it is also true they don't block the stigma circle, as they anyway makes a drug user a deviant, even if they avoid prisons. Finally, administrative sanction in many states have a very strong impact on the lives of people who use drugs. So, to conclude, I have to close. Am I in? Okay. So to conclude, for all that reason, we decided to adopt a paper in favor of decriminalization. And even if we had not the possibility to establish a single model of decriminalization, because this is a starting point for the Civil Society for Own Drugs, and we will continue to work on that. But this is the basis of our future work. Okay, thank you.
Thank you. I go directly to our next speaker, which is Milutin Milosevic from the Drug Policy Network in Southeast Europe. He is the chair of the working group which worked on this statement of the Civil Society Forum, and he will tell a bit more about the process and the outcomes.
Thank you, and also thank you to Susanna for the opening considerations, and also for all the work she did, because she actually was the initiator and she made the basis on which we work. My role, especially, and was to do the process, to make sure the process goes on. And I'm very happy to say that we had in the subgroup which worked on the paper, we had people from, as Susanna said, from different positions working together, and it was very enriching, I have to say. Normally, one of the elements is that nobody is perfectly happy with the result, you know, because everybody has to give something away. If you want to achieve something which is between opposite positions, everybody has to give something away. But we think that the final paper is quite okay and acceptable by almost all. This is what I will say later. Just to say first that decriminalization is very clear in the paper. Decriminalization is one of the elements of one of the opportunities to regulate drugs, and there are others like legislation, decriminalization. So we were very strict and very clear in saying that we talk only about decriminalization. And there is a problem that very often it is seen by some people as legalization of cannabis, especially as it's also happening now around the world. And we were really concentrated on decriminalization of personal, of possession, of use and possession for personal use. And around the world at the moment there are 67 jurisdictions in 41 countries. The data is from October last year, that have adopted some form of decriminalization of drug use and possession, with models which vary greatly from one to another jurisdiction. We discussed various models from different, sometimes completely opposite positions, and everybody was involved in this. What activities could be decriminalized? This is first the drug use itself and possession for drug use, but there are some other things which are potentially some activities, actions which can be also taken into consideration. First of all, is cultivation of certain plants for personal use, that usually refers to cannabis or coca. And then social sharing, which is present in several countries of Europe also, which is kind of possession of large amounts of drugs to share among friends who use without financial gain out of it. And also possession of drug paraphernalia, sterile needles and syringes, crack pipes, and everything else which goes there. So there are different models and different steps which the jurisdiction, the country can take to adopt. We did the survey, and I will show the results later, because when the survey showed that there is a broad agreement across all the CSUD members that decriminalization of people who use, which includes decriminalization of possession and use, is agreed for everyone. And that's, I think, one of the key points, that other, especially the positions about activities which would lead to cultivation, decriminalizing cultivation and social sharing, didn't get support from something like 30% of the forum. So it means it's a critical point, and it's, as Susanna also said, there is no golden model that everybody should have to adopt. There are options, and every jurisdiction can take their own decision in accordance with their social, cultural, political, historical, economical conditions. Which drugs are to be decriminalized? There are jurisdictions which cover only specific substances, and it's mainly cannabis, but there are also who decriminalize all drugs. Position of the Civil Society Forum, majority position is that we propose that all drugs will be decriminalized. But also there are options that there could be thresholds for specific substances, and this is what every jurisdiction can take in their own considerations. Which activities should be decriminalized? Many jurisdictions have opted for alternatives, including administrative sanctions. How do they react? Going from fines to educational courses, and all the way to administrative detention, and referrals to health and social services, while others do not take actions against a person caught in possession of drugs. So there are also what you can do with the person when there is a contact, and how to process the behavior. A majority calls for decriminalization model where there is no more sanctions, further whether administrative or criminal, or impose on people who use drugs. Mechanisms should be in place to refer people who use drugs to adequately funded gender and age-sensitive harm reduction, treatment, health, and social services, always on voluntary basis. For us, it's very important that it's always on voluntary basis. But also, decriminalization measures should not impede drug supply prevention measures and monitoring mechanisms to detect and prevent potential increase of availability of drugs, or to increase the drug use disorders. So that doesn't mean that everything is open and everyone can do whatever he or she wants. Very important point is expungement of criminal records and reparation measures. Around the world, there are 470,000 people currently incarcerated for drug use and possession of drug, with devastating long-term consequences. We think that it would be also important to kind of delete all the criminal history when decriminalization is taken as an action, because that's what stigmatize and affects people, as we heard. Very important point is training and sensitization, and it's especially addressed to public authorities who need to be not only aware but also trained to implement the decision of decriminalization. But also campaigns should be targeted at the general public, because without support of general public we could not make a full effect. The resources should be redirected from policing towards health, justice, and social support. You know the data that at least $100 billion are spent each year on law enforcement in the world. The Harm Reduction International calculated that 10% of such spending for 1 year would be able to cover all global HIV prevention for people who inject, not for 1 year, for 4 years, for people who inject drugs. So it is critical that financial resources are redirected away from policing and drug law enforcement towards evidence-based health and social measures for people who use drugs, again including prevention, risks and harm reduction, treatment, rehabilitation, care, and recovery. And very important, meaningful participation of affected populations. People who use drugs and people in recovery should be meaningfully engaged in design, implementation, and evaluation of decriminalization policies. This is to ensure that their knowledge and first-hand experience are taken into account in the model, and to prevent, avoid, and redress any possible negative consequence of the decriminalization. So this was the framework in which we discussed, and then we, to be sure that we would have a clear support from the CSFD members, we did a survey where we wanted to assess which and how of these methods elements would be supported or not. So we had 43 out of 43 organizations, 29 responded, which is kind of 2/3 of all the forum. Unfortunately, it was done in the beginning of summer, so some of them were late, and we already got some late response which were not taken into calculation, which we did. So what we agreed, we had two sections in the survey. One is the scope of criminalization model, and the one is other related measures. So you can see that these are all the measures which were supported by over 80% of those who replied. Where we didn't agree, and that's actually the thing which is, as I said, there is always, we cannot get full support, is, as I said, cultivation for personal use, social sharing, no sanctions. As I said, majority proposes there will be no sanctions at all, but normally it's not fully supported. And fines also, eliminating fines for like 70% of the support. So in conclusion, I would say just that as I think I already said, that I'm very happy with the good level of cooperation and understanding, and I think it's a good basis for future work, and I'm quite happy that we understand each other. We understand that there are different positions, and before, I have to say, before we didn't want to talk with the other side, whatever the other side is. And the other thing is that we all agree on, at least on the basic level of decriminalization. Two more things I would like to say. There is another side event on decriminalization tomorrow at 8 o'clock in the morning, organized by Release. So maybe you can also, if you want to follow on this, you can go there. And I will show you just two slides from Serbia to tell you why we are behind this. This is the analysis of the crime related to drugs for 2010 to 2021. 69% of all the people who were processed for drug use and possession, and 30%, less than half for criminal, which is related to drug production, sale, and everything else. Even the next slide is even more interesting. The number of those who are processed for possession is growing every year. The number of those who are processed for criminal is decreasing every year. And that's the reason why we are behind this, why DPNSEE also with other countries around. And I have to say that thanks to good cooperation with the Office for Combating Drugs and some other institutions, we are part of the process of amending criminal law currently in Serbia, where there are good signs that the decriminalization will hopefully be integrated in the new criminal law. Thank you.
Thanks, Milutin. And now it's hard to summarize this whole process because we're demanding in only a few minutes. Next speaker is Augusto Nogueira from Macau, and he's also a member of the DPNSEE committee, and he will represent the position of the prevention of recovery.
Thank you, Catherine. So before I start, I'm here on behalf of the RTM Macau, not the NGOC. Besides that, so I was invited to make part of this side event because we believe in moderation. ARTM Macau, we run treatment committee, we run prevention projects, and we run industry programs and medical programs. So we have, we think that we need to have a holistic and a combined several diversity of work, so we can help everybody. So, and I'm sorry for my English, and I get nervous. And also, if I say some words that is not my mother language. Anyway, so I don't need to speak about drug criminalization because everybody agrees and everybody knows what our in our side, we think that drug decriminalization should combine with education, prevention, and treatment and recovery. We should work all together and to achieve this objective. We must invest in education programs that provide age-appropriate, accurate information about the risks and consequences of drug use, also taking into consideration the level of vulnerability in our target populations. Otherwise, we believe that can take the risk of serious public health threats, as we can see now in some countries that there was disinvestment on education, prevention, and treatment, and recovery, and now they are facing severe consequences. And one of these countries is one of the pioneers of, let's say, of the drug decriminalization, that now they are suffering a little bit of the disinvestment that they have in these last 20 years. Decriminalization of drug use also needs to take into consideration some factors that are important for our communities, our health, and our youth. Therefore, decriminalization of drug use needs to be regulated to avoid the potential increase of the availability of drugs. Governments need to provide the necessary resources to supervise compliance and measure the effectiveness. Whether you like it or not, drug consumption can lead to a spiral of problems, even when decriminalized. Addiction, violence, unemployment, overdose, early experience, school and academic performance, driving under the effect of drugs, for instance, reflective reactions, and many other factors. Saying this, there are risks that need to be attended. Concepts that need to be critical, examined, and better defined include, for example, on the document, the social sharing. What does it mean, social sharing? In our concept is just people sharing a joint, sharing between them, because and we understand, myself I understand because also of a drug user, so I understand that we should use together to avoid consequences, to avoid people can help each other. So it's a common situation, we understand that. However, the wording in the document is too vague and can be widely interpreted for different situations. In some countries, ambulance always call the police when encountering an overdose. That is one of the things that was on the document, that people tend to run away, or there's this possibility. But if the police use a discreet approach, as in some countries, when to help the person, the police only should react if they see huge amount of drugs. A vague social sharing concept can contribute to the creation of an illegal market, increase consumption among peers, and override age controls. Personal cultivation, which was one of the things on the document, can be counterproductive too. If one of the motives of the decriminalization of drug use is to regulate drug markets, ensure quality control, reduce the prevalence of adulterate substance, and generate revenue that can be invested in drug education, prevention, treatment, recovery, etc., we don't see how personal cultivation can guarantee that safety of health safety. We agree that prison sentences are not appropriate, and no one that uses drugs should be sent to the prison solely because of drug use. I think it's our body, and if we don't own our body, so I don't know what we can own. And we agree that decriminalization should include drug use and possession of small amounts of personal use. However, sanctions and fines should be kept and implemented in accordance with the situation. For example, driving under influence or other minor trespasses. Fines should be allocated to support the treatment and recovery of those in need. So we don't say that people that should get the fine and sanctions because they are on possession, but by some minor irregularities that they can do it when they are under eventually the influence of drugs. So as people was saying, so people cannot do whatever they want, and then the excuse that they were under the effect. Prevention efforts should focus on addressing the underlying factors that contribute to substance use, such as poverty, mental health issues, and social inequality. In conclusion, decriminalization of drug use offers a promising alternative to the failed war on drugs. It prioritizes public health, reduces the burden on the criminal justice system, promotes harm reduction, weakens criminal organizations, and allows us to allocate resources more effectively. It is time for us, we think, that to approach drug use with compassion, evidence, and a commitment to improve the lives of individuals and communities affected by addiction. So let's embrace decriminalization of drug use as a package, hand to hand with education, prevention, treatment,
from the Croatian Institute of Public Health, and he will share some experiences.
Okay, thank you very much. Thank you very much, Madam Chair, for giving the floor. I was actually very, very excited about this item, so in the morning I forgot my badge. I already did my morning exercise, and especially because of that, I really hope that my presentation will be interesting to you. I will speak about our practical experience with the criminalization in Croatia. Just a second. Function of, but can you start this slide? Okay, you will help. Okay, I will present in the presentation a few words about the trends in Croatia, say a few words about the national strategy framework, about our new national strategy. Of course, legal framework is very important because we speak about criminalization, we will speak about the criminal policy trend, alternative penalties, and what we actually learned from this 11-year experience after decriminalization. Actually, 2013 we decriminalized possession of personal use without the purpose of selling in Croatia. Trends. Actually, when you saw us trends, I think it's on the first look, everything great. Our trend of drug users and treatment is stable, but we have a lot of problems with the prevalence. If we just compare the data from 2011, 2015, and 2018 from our general population survey, we can show that we have increase in the prevalence of drugs. Actually, that also the problem increase also shows the increase of the number of the seizures of types of drugs in the last 10 years. Trend of criminal offenses is stable. You will see also on the graph. After the 2030, it was increased and it was stable. And for our implementation of our drug policy, Croatia approximately spent on yearly basis approximately 120 million euros, and almost 50% of that amount is for addiction treatment. New strategic framework, our new national strategy is coherent strategy, and for the first time we put together drugs, alcohol, tobacco, and addictive behavior, but the principles of our strategic frameworks are the same like the X strategy. It was balanced principles between reduction of the supply and demand. When we speak about the priorities within the scope of the criminal policy, we have to say that priorities is strengthening health and social programs for drug-related criminal offenses, developing the guidelines on cooperation between healthcare, social welfare, and law enforcement. Also provide suitable professional assistance to offenders on the earliest possible stage of the legal proceeding. This is actually something that is very important, that misdemeanor process is much faster and much flexible. I will explain about that later. And also, very important is strengthening the integrative approach and digital training, teach the law enforcement and prison staff who are working with the person who have addiction problem. Legal framework, decriminalization, criminal procedure code, law enforcement code, or law on combating drug abuse are main legal acts that regulate drug-related offenses. Possession of the drug without intention of sale, possession of for personal use, has been reduced to misdemeanors from the 1st January of 2030. That actually means that personal drug use is not longer punished with jail in Croatia, but the offender have to go to the treatment of counseling. What that actually affect on this criminal code amendment, that means that was the reduction of number of cases in the criminal code, because possession became misdemeanors. There is less pressure on criminal justice and prison systems. Law enforcement can focus on more serious crimes. In that period, I was a police officer, and I really believe that actually the criminalization can give us opportunity to focus on serious organized crime, dealing, selling, and etc. Also, it's saving funds. Everything is, at the end, it's about the money and how efficiently you spend your money. And Also, that already mentioned is the legal procedure is much flexible, is much faster. There is the period between when the police arrest you and when the judge is much shorter. That actually give you opportunity for that you immediately can start with the intervention. There is not so much stigmatized. There is no criminal record for the person who was arrested, and also all the rehabilitation process can be easier and can be started easier and before. Okay, this is just a few graph about reported local criminal offenses and misdemeanors. The criminal offenses were stable, but the misdemeanors actually depends on the seizures. You have to know that Croatia is a touristic country, and actually the most of our seizures was done during the touristic season. Our police is ready for a lot of tourists who are coming to have party in Croatia, but that actually means that the seizures increase, and this is also the number of misdemeanors. Actually, you can see decrease 2020, 2021, 2019, then was the corona. But tourism sector is recovery, and actually we can expect more and more seizures. Also, when we saw the adults and minors conducted for drug-related offenses, you will see the stable trend, or you can see that was what was happening actually, the decrease when 2013 and 2014 after the possession became the misdemeanor. If we speak about the type of the sentence for the criminal offenses, this is most of the sentence was suspended sentence and prison 1 to 2 years. So very rare it's prison 1 to 10 or 10 to 15 years, so not for the serious crime. Alternative penalties, just a few words. Actually, one of the very important things is this is a principle of opportunity that's allowed to the state attorney to stop with the procedure if with the prosecution for the offense which is punishable by 5 years. That principle of opportunity was often used in the past before 2012, especially for there was some kind of agreement between the state prosecutor and the person who possessed the drug at that time. And actually, if you go to the treatment, you will not start with the prosecution. That was function, but after decriminalization, it was not so much necessary. Of course, there were some changes in the criminal code. We speak about these alternative penalties. Alternative prison sentence, which means that time spent in treatment is included in the prison sentence, and also treatment in health or other special institution in addition to a suspended sentence. Of course, there is also the same possibility with the Misdemeanor Act. Suspended sentence in combination with a special obligation. Actually, the purpose is not to punish the people, but send them to treatment or the consent. Also, there is the measure of mandatory addiction treatment of people who are drug users, and also treatment in addition to misdemeanor penalties. What we actually learned in last 11 years, unfortunately, the first initial contact with the penal system is actually the first contact when the person will have to go to the treatment, and often is the only method of how to refer people to the treatment. Actually, from our experience, the most of the people who have problems with drugs very voluntarily came to the treatment. So we use this method to actually use this opportunity when you be arrested and you have to go to the court, then actually prepare you to start with the treatment. And also one good things what we actually learned, what our criminal registration system learned, actually criminal legislation can adopt this positive approach to reducing or replacing sentence for criminal offender who have drug disorders problems. Thank you very much. That will be all from our side. If you have any question, I will be glad to answer you. This is practical experience what actually happened in the last year after the criminalization. use without, this is actually very important. When I speak to judges, this is just very important how to explain. This is how make differentiation what is for personal use. For personal use is any amount of drugs without attempt to sell it to another person. We can actually, for personal use, we can have 1 gram, 2 gram, 5 gram. There is no intention for selling to another person. Also, if you would like to intention to sell it, it would be criminal offenses if you have 0.5 gram. This intention is very important. And also very important thing is that we start and actually we believe this is treatment for the person who was arrested in possession is much more appropriate sentence than the jail. Thank you very much.
Thank you. Next speaker is Athanasios Theocharis. He's president of Okana in Greece, and he will tell.
Thank you. I would like to thank first of all Newton for the invitation here, and I'm very happy to hear that we can stand in a table and discuss things who are in favor or not, and it's very crucial for that. Because some countries, okay, they might have done some steps, but others are too far away. So, Okana, as you may know, it's one of the largest organizations in Greece confronting the drug treatment and prevention and harm reduction as well and reintegration. I would like to say that my contribution today is within a different kind of concept, meaning that there have been some remarkable advancement in Greece towards harm reduction especially, and they have passed through some legislative, let's say, efforts that we have made in the last few years. These endeavors have not only saved lives, but also have paved the way for a more compassionate and effective approach to addressing drug use and addiction. For us, it's not only a matter of decriminalization as a hard way of saying so, but it is a matter of respect, a matter of treatment, access, and human rights. So, as we have expanded the use of naloxone, we have created a drug consumption room, saving more than 200 lives all these 2 years. And as we have embraced innovative, let's say, approaches of like mobile DCRs or mobile units or low threshold mobile units in several cities, all these initiatives I may say that they have prioritized the accessibility and the aim to reach all these people who are hard to reach and they are marginalized. It is important that, to say that in Greece the roots of our drug policy is based on open-mindedness and focuses on a more holistic, let's say, and people-centered perspective. We view as the drug addiction as not as a moral failing, but as a public health issue and more a health issue. It's a different mindset, let's say, and our policies reflect to this kind of concept. We are seeking to improve our strategies based on evidence and best practices, which will also help us in order to prove to politicians as well how this work can help them and can support all the policies from criminal offending and treatment as well. I'm very optimistic about the future of drug policy forming and policy making in Greece, because we have open ears from our politicians lately, which was a crucial issue in the past, and Marios, who is from the civil society in Greece, can also declare that in the past we had a different way of thinking, And I will have to tell you, I always tell this, that all these achievements that happened in Greece happened within a liberal and right-wing government in the last 4 years, which is very significant to see that you can convince a government who is not very aligned with, ideologically aligned with the evolution of treatment and services. So we are viewing drug addiction as a medical condition, first of all, and we do not think that it is a criminal offense, and we believe so. We try to push and transmit this message to our politicians. For example, we have discussed for legalization of certain drugs in Greece now, such as cocaine or heroin administration from specific points, and this will help us to minimize the harm, to promote the public health, and to give potential pathways to drug legalization. All these kind of low threshold treatment programs can help people who are in need and who are in drug addiction. So our thought in general is not something that as a Greek policy-making body is that decriminalization cannot exist by itself alone. It should be combined with extended spectrum of services, with respect, with accessibility, and with all these supportive services covering basic needs of people who use drugs. This meaning that we have to support people who are homeless, who are in several needs, in need of primary health care, so we can avoid with that criminal activity or whatever else comes within such kind of environment. And of course, to help people who are hard to reach. This is an issue which we want to mitigate and make it more accessible for all these people who are in faraway areas. And for all of us, treatment is treatment. So we should be supportive to them and not to be offending them, to be criminalize them, and to have them in a specific, let's say, framework which would be very difficult for them. I believe in harm reduction because it's on the field and it can help us in order to understand all the issues that these people have. So, as being committed with that, I think that having services like that can help also to make better thoughts and better policies on decriminalization, and we will try to change our politicians and our policymakers into that aspect. Thank you very much.
We do have a last speaker for this round, and I know that the session officially ends at now, more or less, but as there is no follow-up session, I hope you have still some time to listen. Who will speak is Grazia Suffa, and she will tell something about the case of Italy in the 1990s. So unfortunately, she is not here with us, but she has recorded statement.
Asked to explain the Italian decriminalization model. I think it is one of the oldest experiences of drug use decriminalization in Europe, I think. And it dates back to 1993, when there was a referendum about the punitive shift and the punitive law established in 1999. And the hot point of the political debate was just the criminalization introduced by the 1999 law. And the referendum was quite a success, because 55% of Italian citizens chose to abolish penal sanctions for personal use. But administrative sanctions were not abolished, and so it was a victory, but the reformers immediately realized the limits of this kind of decriminalization, and they immediately started to campaign for what they called a full decriminalization model, and later on we will see the features of this new model. What is the result of more than 30 years of drug use decriminalized? If we look at the figures, we see that the figures are not impressive, because 34% of prisoners in 2022, 34% of prisoners have been incarcerated for drug offenses. And so we can, this is a high rate of incarceration, and we can say that the present overcrowding of the Italian prisons is due to the drug legislation. So let us realize the reasons of this. First of all, a drug legislation can be highly punitive even without penal sanctions for personal use. And the Italian law is harsh, we can say. First of all, because the law provides administrative sanctions for personal use, and these are very harsh, ranging from the suspension of the driving license, the suspension of the passport, up to periodical mandatory checking in at the local police station. And the figures of the administrative sanctions are quite shocking, I think. In the last 3 years, for every year, about 30,000 people are caught by the police with a small amount of drugs and deferred to the administrative authorities. 75% of them are cannabis users, and 38% of them receive administrative sanctions, the ones that I have already illustrated. Secondly, the penalties for the penalties provided by the key article of the law, which is the 73 article, the one which says whoever grows, produces, sells, hands over, or in any way is in illicit possession of psychoactive substances. This is the main article. So the penalties range from 8 to 20 years for drugs in Schedule 1, that is heroin and cocaine, and from 1 to 6 years for drugs in Schedule 2, which is cannabis. And also, we have to notice that the framework of the Italian legislation, in particular of the main article, the key article, the Article 73, follows the wording of the UN conventions. I have already read it. That is that the article enumerates several misconducts, but also possession is quoted, because it says or whoever grows, produces, sells, or is in any way in illicit possession of psychoactive substances. And this means that it's not easy, particularly for in the Italian penal system, where there is no expediency principle. So it's not easy to distinguish between possession for selling, for dealing, and possession for personal use, and that's another point. So I just want to read the opinion of a group of prominent jurists, and they just wrote that decriminalization of drug use is not sufficient to address the problem of most marginalized addicts involved in petty crimes and in small-scale drug dealing. Presently, this is quite important, provisions for dealing are still calibrated to large-scale dealing and trafficking, resulting in over-penalization of small dealers. I just said that since the beginning, since the victory of the referendum, the reformers campaigned for what they called a full decriminalization model. What are the key points of this full decriminalization model? First of all, milder penalties for drug dealing, a reduction, because at the moment there is also a distinction between drug dealing, the key article 73, and penalties for minor drug crimes. It means for people who are in possession of smaller amounts of drugs for dealing. But this is not enough, so a further reduction for minor dealing, and for offering drugs not finalized to sale would be important, and also a thorough review of administrative sanctions for drug use. Today, I also think that in this full decriminalization model, we should include legalization of cannabis legalization. And we have to consider that 2 years ago, more than 500,000 signatures for a referendum about this issue were collected in less than 1 week. The referendum did not take place because the Supreme Court did not allow it, saying that it was against the UN conventions. And we argued this judgment, but of course we have to try again. And so, in conclusion, I think that decriminalization of personal use is still important because it's a symbolic issue, but it's not sufficient if you want to reduce the criminalization of the drug problem in general. Thank you very much.
I would like to thank you for your patience, and I think we can still have open the floor for some questions or remarks from your side, if there are any.
Yeah, and just a question I wanted to ask for, what treatment is it when we speak about decriminalization? What treatment do the drug users get? Especially maybe from Seiko, Mr. Seiko, Petko.
Depends, you can go to medical institution.
Do they get specially psychotherapy?
Yes.
Okay, they get.
Yes, yes. Actually, the treatment must be equal for all people. It depends. If you go to prison, you can get equal treatment. If you go free and go to the medical institution, the treatment is the same. There is no differentiation between the treatment. That was actually the point. And that because of that, it's allowed you, like opportunity section, to go to some NGOs and go for treatment.
I'm working for one of these in Austria, so I'm working with clients where they're getting treatment for free in Austria if they are in contact with illegal substances or alcohol either. We would get a fully paid therapy from the state.
Yes.
Yeah.
The
It's the same
states
as
have to provide you because
Super.
you're a patient.
Yeah, person.
You are a patient, you are not, you have probably who have problem with drugs, they treat you like a patient, the treatment is free.
What quantities of drug can be accepted for personal use?
You will put this question
To everybody, to me. Actually, I tried to explain that on the end of the presentation. There is no point of the quality. That was or quantity. That was the point of there's any purpose to sell it to another person or not. This is, depends what you would like to do with drug. If the drugs for your personal use, you can use 5, 10 grams. Depends. Of course, you cannot have kilo or 2 for personal use. It depends on the case because that actually means that police have to decide. When they arrest you, they have to prove you this is not for selling to another person, this is not for the personal use, they will go with criminal prosecution. If it's for personal use, they will go with misdemeanors. There is no differentiation here. Of course, we made few debates about this, whether this is necessary to allow less 1 gram, more than 1 gram, but opinion from the judges is every specific case is specific, and we have to decide on every specific case.
Actually, for me, first from Macau, I mean, we have not this concern that a certain amount, a small amount, after a certain amount, small, the police can decide by the law that is for traffic. They don't need to prove that was intention to sell.
But our law, they have to prove it is intention. Yes, they have to prove.
For
That there
every-
is intention.
For every criminal offense, you need to prove intention. For every kind of criminal offense, not only related to drugs.
Unfortunately,
This is not true in
It
Italy.
would be much easier, actually, if we have some, some amount. We have scale with no, it's less than 1 gram, you will go with the criminal charge. Or more than 1 gram. If it's less, you will go with the misdemeanors. It would be much easier, but this is actually sometimes big debate about that when I was.
I must say that this is not true in Italy, unfortunately. If you are found with drugs, even cannabis, the proof of intention of dealing is not, they don't need to have a proof. It depends on the quantity, but the quantities are very rigid. And so even if you are a person who clearly doesn't need to sell and has never been proven to sell anything, you are prosecuted successfully. And may I add, even on the compulsory treatments, because I understand compulsory treatments is a bit like medicalizing something that is not necessarily a problem for a person, because taking drugs is not always a problem for a person. This is something that should be properly understood.
Yeah, but for the minors, for example, it's intention to have a health protection measure if the minor
Or counseling is sometimes good enough. There is no necessary to say to the treatment.
Not to the institutionalized treatment, it can be just, counseling, just.
Yes, okay, that would
That
be,
would
that would be,
Not
yes, that would be something. That's a good
residential
question.
treatment or something like that.
There is a few different possibilities to say.
I think this is a really interesting discussion, which, and also Susanna and Lucan just said, it would be great if we would have more time to explore that more in detail. But unfortunately, I think we need to go because we are already 15 minutes late. I would like to thank you for your patience, for your contributions, the speakers, the organizers and co-organizers,